A new medical study is highlighting a concerning trend in the emergency room that could prove deadly for some patients. The study, published in the Journal of the American Heart Association, finds that women and Black adults face longer wait times in the emergency room for chest pain. Those are moments that could present potentially fatal outcomes for patients. The study also points out that doctors are less likely to admit women into a hospital when exhibiting similar symptoms as male patients. Dr. Darcy Bonko is the lead author of this report. She joins us live this evening. Thanks for being here. So what exactly did the study find, and how did you measure these results?
Yeah, thanks so much for having me on. It's exciting to be here. So our study looked at whether or not there were differences in the way patients were treated and evaluated when they came to the emergency room with chest pain based upon their sex or their race. And the reason that we looked at this is because we know that the number of heart attacks that young adults are experiencing has been rising in recent years, and that women have worse outcomes compared to men, as well as Black adults have worse outcomes compared to white adults when they experience a heart attack. And so this was the first study to try and answer the question of why that's happening. And so what we found is that, as you said, women waited longer compared to men, and Black adults waited longer compared to white adults. And we even found that Black women waited longer than white women. And so this was surprising and concerning for us.
And why do you think it is? What do you attribute the reasoning to?
Yeah, that's a really good question. And unfortunately, our study wasn't able to exactly answer that question, but it would be a really important question to answer. But I can kind of offer a thought is that I know when I went through medical school, they would often teach us that there were patients that would experience what they called atypical symptoms. For example, women, Black adults, older adults, they were always taught when they come in with heart attacks, they're going to have atypical symptoms. They might not have chest pain. And actually, what we found over the years is that they do have chest pain. About 80% of women have chest pain when they come in with a heart attack. And so I think some of the messaging has been a little bit confusing about kind of what's typical and atypical and what symptoms people present with. But I think we should really simplify things, and that when patients are having chest pain, we need to really consider whether or not heart attack could be a potential explanation.
And what should we all know as patients? How should we approach healthcare, especially in an emergency situation? You're panicking, you don't really know what to do. How do you advocate for yourself in that kind of a circumstance?
Yeah, absolutely. I hear it from patients all the time. Having chest pain and going into the emergency room is really scary and overwhelming. But I think keeping it simple is important. If you feel a new sensation, chest pain, chest discomfort, squeezing pain in the chest, you should definitely seek medical care right away. And I think when we say pain, a lot of people think of something specific, but it can really feel a lot of different ways. It's not always pain. Like I said, it can be a pressure or a squeezing sensation. I think the other thing that people should really remember is that when they go to the they go to the emergency room or go to their doctor, they should ask specific questions. Am I having a heart attack? How do you know? I'm concerned I'm having a heart attack. Using some of that language can kind of prompt physicians to really consider that in the diagnosis. The other thing to remember is that calling 911 can be really helpful. Calling 911 not just gets providers to your house more quickly, but they can also actually do some basic tests and start treatment right away when they come to your home. And what we know is that women and Black adults are less likely to call 911. They're more likely to walk into the emergency room, and that really sets them back in terms of how quickly they get there and how quickly treatment is initiated.
And there are so many other issues that go along with that. I mean, so many people are worried about the bills that are going to come later from the ambulance and the transport, et cetera. Given what you've learned, what are you still interested in finding out? What are the follow-up questions to the results of this study?
Yeah, that's such a good question. I think, as we had mentioned before, trying to determine why there are differences in wait time, because if we don't really determine why there are differences, we can't really fix that. And the other thing to think about is what else is contributing to these differences in outcomes? Is it just that patients are waiting longer, or are they experiencing other differences in the way that they're being taken care of later down the line? I think wait time is just one of the things that is made be different between men and women or Black adults and white adults in terms of their medical care. But I think we just need to keep asking those questions to try and to define as much of the differences and disparities as possible so we can actually determine where we can intervene and make it better.
All right, Dr. Bonko, really interesting results and important information. Thanks for joining us tonight.
Thanks for having me.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.